asking a question about the 69 million being decreased, the state general fund being decreased, and the social services block grant money being one-time money being increased for the purposes of dealing with the Medicaid match and to make sure you could deal with your Medicaid problem. Is that right?
Well, it's primarily just to try to maximize the federal dollars. I mean, if we took the 93 million and just spent the 93 million, we would be leaving 400 million on the table. So there was no other way to maximize those dollars other than to put those SSBG dollars into the program offices, which freed up the state general funds. Then you move the state general funds into Medicaid, and that's how you maximize the federal dollars.
Which leads me to my final point. If we had an opportunity to replace $215 million in state general fund, we could also maximize that, right, with federal match dollars.
If you put any new dollars you put into Medicaid does bring down additional federal dollars, it also creates a bigger hole in a year and a half.
Yeah, but can you use some of those dollars for one-time programs?
You can use them where the legislature wants to use them for, sure.
No, I'm just saying, like, if there were one-time programs that you wanted to institute for just 2 years.
Hard to do in Medicaid. I mean, you start a program in believe me, you start a program, you create a constituency, then you come back and try to cut the program 2 years later.
Well, could we?
I'd be tough.
Yeah. Well, let's use the one that we're creating this year with sexual violent predator program. If we used the Medicaid dollars, could we use the Medicaid dollars for that program?
No.
Can't. Okay. We have programs that are in existence that we could limit to the 2-year period, and so when that gets cut we could just reduce those dollars, right? Are you suggesting that we not take advantage of what we could get this year? I mean, that's why we're using stimulus dollars, right?
You can put any state general fund dollars into Medicaid and draw down federal dollars. That's certainly a state policy.
Well, the final point is, how does smoking, and you're avoiding it, but how does smoking impact our health care problem?
Smoking, obesity,
no, smoking.
addictive disorders.
I'm not asking about any of those others. I'm asking about smoking. How does smoking impact our health care costs?
Smoking impacts our healthcare costs for sure. I mean, people smoke. It creates pulmonary problems. It's a cancer risk. Creates high blood pressure. Sure.
Do you have a dollar figure on what that impact might be?
Not with me, but certainly there's estimates. Sure.
Do you think so? Do you think that the people that make those choices should pay a price associated with the choices that they make? I mean, it's impacting your budget, your state budget annually. You have to pay for people who don't have insurance and experience problems, healthcare problems, that your budget needs to cover as a result of their choices, right?
I have to say, yes, we all make lifestyle choices, and to some people, smoking is a choice. To others, it's an addiction.
Right.
And so
that's true. Fair statement.
I think I want to draw a distinction there. And there is definitely a cost to that.
So if we have more money not only to handle those that make the choices, but those that are addicted, then that would be a good thing, because it would reduce the impact of healthcare costs on other things, right?
Anything that reduces smoking is I think, critical for any healthcare program, not just the public payers, but the private payers as well.
Do you think that the increase in the cost of the product would reduce smoking?
I think
Do you believe that?
Let's not dance around it. You're talking about a tax on cigarettes, and I think anytime you tax an activity, it has a diminishing impact on that activity.
Right.
Whether you're taxing cigarettes or small business or individuals,
right,
you're diminishing that activity, yes.
Right. And
but there's also other things that diminish smoking. Mm-hmm. Strict clean indoor air laws studies have shown that clean indoor air laws actually have as much of an impact on reducing smoking as taxing.
And we did that.
Well, some have done it even more than we've done it. We still allow some. But
I've got until this afternoon. Tell me what you want. I can file it. Give me an example. What's the top of the list? I got one bill left.
Well, Let me see who I'm picking fights with here.
It doesn't. I'm not worried about the
No,
fight.
I mean,
as you
no, I
can
mean,
tell.
there's been states that have gone as far as completely banning indoor smoking in any establishment, period.
I think right now we've got restaurants, people who
There are
serve
some
food.
exemptions for bars if they don't serve food or whatever. So yeah, I mean, but the point is though is that whether it's active intervention through cessation programs,
Right.
whether it's aggressive marketing campaigns to children, there are multitudes of strategies that have been used effectively to reduce smoking.
Yeah.
The answer to your question is if you tax cigarettes on top of the 62 cents per pack that was just imposed by the federal government, if you tax them additionally, yes, I do believe you will have a reduction in the number of people that buy cigarettes for a period of time.
Sure. And then those monies could potentially, not that that's your decision, but could
No.
potentially be used for the addictive nature of it and cessation programs. It could be used for other healthcare related programs because of the use of the product. We could do that. We could ultimately, if that tax were dedicated to your budget, healthcare budget, you would reduce not only the burden that you have in facing your deficit, but also we could over time reduce healthcare costs. You agree with that? Because of the reduction in consumption.
Reducing smoking will over time reduce healthcare costs.
That's all I need. Thank you, Mr. Chairman.
Mr. Secretary, I'm just curious, as a result of Representative Peterson's questions, how much is the estimated cost of smoking in health care on the state? Do you know?
We have that data. I'll get that for you.
Oh, you don't
I
have
it
it
off
now?
the top of my head. No,
Does anybody here have it now? Because I'm kind of curious. That seems like that's important.
I don't want to give you a bad number. I mean, there's been multiple studies on what the cost of smoking is, and we can have that for you.
Okay, thank you. And looks like the board is clear. Well, we have one other question. That's who is that going to be? Representative Nowlin? All right. First, let me make this announcement. There is an overflow room in committee room number 6. So those of you who are standing up,